Okay, picking back up with Unit 5, Injury Prevention, Part 2. So identification is also very important. You can fail to identify a patient and give them maybe the wrong tray of food. Maybe they needed to have a soft diet, pureed diet, and you didn't identify the right patient, gave them regular diet, and they choke. So knowing who your resident is when you are providing care or serving meals is very important. Burns is another big safety risk in the long-term care setting. You always want to check that bath and shower water temperature. You check it on the inside of the wrist. Let them check it. Make sure that that feels comfortable for them. It should not exceed 105 degrees. Use extreme caution when you're serving hot drinks or food. Make sure you're monitoring temperatures of heating pads, or if they're getting a warm soak. And if you take them outside, we need to think about sun protection. Sometimes medication that a person takes can make them burn more easily. They can get overheated more easily than we can, so we have to be cautious about those things. If their food is hot, make sure that you're not blowing on their food, because obviously that's an infection control issue. But like if it's a pile of mashed potatoes, you're going to push that mashed potato down with a fork to kind of spread it out a little bit, and that kind of helps it to cool off. If a person gets burned, you want to tell the nurse immediately. If their clothing is on fire, use a blanket or coat to smother that. And then we're gonna apply cool water to stop further skin damage. Not ice, not butter, but cool water. Poisoning is another issue in a long-term care setting. So things that are poisonous, like nail polish remover, soaps, shampoos, things like that. That all has to be secured. It can't just be lying around. It really needs to be like locked up in a cabinet. We don't leave cleaning supplies out. You'll see that the housekeepers have locked carts so that those cannot be in reach of a resident. You want to check bedside tables for spoiled foods. So think about if a person has impaired vision or impaired judgment due to dementia. They may see a cleaning product and think it's apple juice or drink or something along that line. So we have to be cautious about different substances. If somebody is poisoned, your most important role, besides telling the nurse, is to determine what the patient has taken. Find the container and bring that to the nurse, because when the nurse calls poison control, they're going to need to be able to give that information to them. So that's what your role is as a CNA. Report the nurse, find out what they were poisoned with. Choking, these are terms in red that you really need to know. Dysphagia and aspiration. Dysphagia, dys meaning difficulty. Phagia with a G means swallowing. So difficulty swallowing. And aspiration is when you inhale food or fluid into the lungs, and that can cause pneumonia. So we need to know about preventing choking. Choking can happen during eating, during oral care, different things of that nature. So we want them to sit up as much as possible. When we're feeding, we feed them slowly, cut food into small pieces. We report any difficulty swallowing to the nurse. Make sure their dentures are in place and well fitted. And if they are like coughing a lot when you're feeding them, that's usually a sign that they are choking or they're aspirating food in or fluid into their lungs. So that's something that needs to be reported. Treatment for choking. If a person can speak and is coughing, we don't intervene. If they're unable to speak, then you're going to start your Heart Association guidelines. So we'll cover that in lab. Cut and skin tears. This is something that you might encounter, and that is also important to know what to do. So the resident should always keep their arms and legs inside the wheelchair when moving, kind of like the roller coaster, right? Don't wear jewelry. You shouldn't wear jewelry that can scratch the resident. So thinking about like a ring that has a stone on it, bracelets, necklaces, things like that, that can actually tear their skin or scratch them. Your fingernails should be short. In clinical, I'm going to ask you to hold your hand up. And if I can see your fingernail poking up over the other side, that's too long. Fingernails need to be kept short. And, you know, you need to think about keeping sharp objects or corners, being aware of those when you're transporting a resident. Bleeding, put gloves on, hold a thick pad, clean cloth, bath towel, whatever over the site. So let's say they're bleeding significantly. You have to protect yourself first. Put the gloves on. Then you apply pressure. It doesn't have to be sterile, but you don't want to pick up something out of the trash, right? So find something that's clean. Push down, hold hard. If you can apply above the level of their heart, that's great. But if you need to add additional pads, do so, but don't remove the first one because that can remove the clot. Seizures is another thing that you might encounter. Seizures are involuntary contractions of the muscle that can involve a small area or the entire body. So the main goal during a seizure is that you keep the resident safe, and you want to time it. Have someone call the nurse immediately, use the call light, something like that, and don't leave the person unless you have to do so to get medical help. If they are banging their head against a piece of furniture, you're going to move that to prevent injury. You can put pillow under them if there's a pillow nearby, but you don't want to restrain them or try to stop the seizure, and you don't want to put anything in their mouth or in their teeth, okay? You could get hurt, and that can hurt them also. Fainting is another thing that you might encounter. If you do encounter fainting, you want to help the person to a sitting or lying position. The head lower than the heart is the goal, and call for assistance immediately. It may indicate that they have a medical problem if they're fainting. Incident reports, you can find this in your textbook. It may not exactly be 47 or 48, but you can look it up in the index if needed. Documents that indicate a response to, An incident report documents the incident and response to it. It's facts, not opinions. It doesn't become a part of the chart. It helps us to learn how can we do things better? How can we prevent this from happening? So incident reports are important. So let's go through some multiple choice practice questions. When should a nursing assistant identify a resident? After giving care, when collecting meal trays, when shift changes, or before helping with feeding. And the correct answer is before helping with feeding. How should residents be positioned while they eat? Lying flat on their backs, reclining at a 45-degree angle, sitting as upright as possible, or lying on their sides. And that would be sitting as upright as possible, C. What information does an MSDS contain? Material Safety Data Sheet. Costs of all chemical, comparison with chemicals, names of other facilities using the chemical, or description of emergency response actions. And that would be D, description of emergency response actions. To maintain good body mechanics while lifting or carrying an object, a nursing assistant should hold the object out and away from her body. B, face the object or person she is moving. C, twist at the waist as she picks up the object. Or D, try to keep her center of gravity as high as possible. So the correct answer is B, face the object or person she is moving. The next question is restraints may be used. A, whenever it is convenient for the facility or staff. B, when a resident is being uncooperative. C, when there are not enough staff members to watch all residents. D, only with a doctor's order. The correct answer is D. Restraint-free care means that restraints are only used if a resident is in danger of hurting himself or others. B, restraints are only used with a doctor's order. C, restraints are only used when restraint alternatives fail. D, restraints are not kept or used at the facility for any reason. Restraint-free care means D, restraints are not kept or used at the facility for any reason. Okay, that is the lecture. I hope that you learned something in Unit 5. Thank you.